1. Which of the following best demonstrates an adult learning approach when teaching food safety standards for health inspector certification candidates? A. Delivering long lectures with minimal engagement. B. Incorporating case studies of real inspection scenarios. C. Using rote memorization exercises. D. Repeating definitions without examples. 2. What instructional strategy is most effective for teaching regulatory compliance to future health inspectors? A. Interactive simulations of inspection violations. B. Reading through state codes only. C. Passive video presentations. D. Group discussions without structure. 3. When evaluating learner performance in sanitation protocols, the most reliable assessment method would be A. Practical demonstration of inspection techniques. B. Oral recall of inspection procedures. C. Peer grading based on personal opinion. D. Written definitions of terminology. For a mentor guiding a new inspector in report writing should emphasize A. Accuracy and objectivity in documentation. B. Personal judgment over evidence-based findings. C. Creativity in language use. D. Minimizing details to save time. 5. Which of the following aligns with competency-based education principles in the HIC program? A. Learners must demonstrate specific inspection skills before certification. B. Progress is based on attendance hours only. C. All learners are certified after a set duration. D. Assessments focus solely on theory. 6. What communication skill is critical for a health inspector when addressing violations during an inspection? A. Providing clear, factual explanations without bias. B. Using technical jargon to assert authority. C. Avoiding eye contact to maintain distance. D. Speaking informally to appear friendly. 7. When designing a curriculum for HIC preparation, which principle ensures alignment with adult learning needs? A. Linking course content to real-world inspection duties. B. Relying heavily on multiple-choice memorization. C. Minimizing practical content to save time. D. Using uniform teaching methods for all learners. 8. Which assessment type best evaluates a candidate's ability to apply environmental health laws in practice? A. Scenario-based evaluations. B. Multiple-choice recall quizzes. C. Group participation grades. D. Attendance records. 9. A key element in maintaining regulatory compliance during food facility inspections is A. Consistent application of public health codes. B. Allowing flexibility based on personal judgment. C. Avoiding written documentation. D. Prioritizing speed over accuracy. 10. In mentoring a newly certified inspector, the senior mentor should A. Provide guided field experiences with structured reflection. B. Focus solely on written examinations. C. Limit interaction to formal meetings. D. Avoid feedback to promote independence. 11. What is the primary goal of evaluation in the HIC training process? A. To measure competence in real inspection environments. B. To assign arbitrary grades. C. To compare learners against each other. D. To promote memorization of laws. 12. When teaching adult learners about public health ethics, an effective method includes A. Discussion of real ethical dilemmas encountered in inspections. B. Memorizing ethical codes verbatim. C. Avoiding sensitive topics. D. Delivering non-interactive lectures. 13. Which of the following best promotes critical thinking in HIC candidates? A. Analyzing inspection case reports for compliance accuracy. B. Copying inspection forms from templates. C. Memorizing state codes without discussion. D. Skipping debrief sessions. 14. How should a trainer handle diverse prior experience levels among HIC learners? A. Differentiate instruction based on learner background. B. Deliver identical content to all learners. C. Expect all learners to progress at the same rate. D. Avoid open discussions. 15. What is the most appropriate evaluation tool to assess inspection communication skills? A. Role-playing exercises with performance rubrics. B. Written memorization test. C. Peer self-assessment without criteria. D. True-false questionnaire. 16. What regulatory principle underpins the work of health inspectors? A. Enforcement of public health and sanitation laws. B. Personal interpretation of regulations. C. Minimization of inspection frequency. D. Private decision-making autonomy. 17. During curriculum development for the HIC program, which step ensures program effectiveness? A. Aligning learning objectives with certification standards. B. Using outdated materials to reduce costs. C. Skipping stakeholder input. D. Ignoring assessment data. 18. A health inspector trainee demonstrating self-directed learning would A. Research current foodborne illness trends independently. B. Wait for the instructor to provide all materials. C. Focus only on memorizing test answers. D. Avoid additional study outside class. 19. To reinforce knowledge retention among adult learners, instructors should A. Encourage learners to connect new content to prior experiences. B. Present information only once. C. Discourage group discussion. D. Limit contextual examples. 20. What type of mentoring feedback promotes performance improvement? A. Specific, timely, and constructive. B. Generalized and delayed. C. Critical without solutions. D. Minimal to encourage independence. 21. What communication method ensures professional transparency during inspections? A. Clear, documented, and consistent messaging. B. Informal conversation without records. C. Emotional responses to non-compliance. D. Nonverbal cues only. 22. When evaluating learner progress in tech training, formative assessments help A. Provide ongoing feedback for skill improvement. B. Assign final grades only. C. End training sessions prematurely. D. Replace practical evaluation. 23. Which instructional design model supports continuous improvement in the HIC curriculum? A. ADDIE model, analyze, design, develop, implement, evaluate. B. One-time training delivery model. C. Lecture-only format. D. Static syllabus model. 24. The purpose of integrating legal updates into ongoing HIC training is to A. Maintain compliance with evolving public health regulations. B. Simplify training requirements. C. Reduce training hours. D. Focus solely on outdated standards. 25. What principle of adult learning emphasizes relevance? A. Adults are motivated to learn when content is applicable to their work. B. Adults prefer abstract theory. C. Adults learn best through rote repetition. Adults avoid real-world application. 26. In designing evaluations for HIC learners, reliability ensures A. Consistent assessment results across different evaluators. B. Scores vary randomly. C. Outcomes depend on subjective opinion. D. Evaluation is unstructured. 27. What element is most essential in building a compliance culture among inspectors? A. Ethical leadership and accountability. B. Competitive rivalry. C. Inconsistent enforcement. D. Avoidance of documentation. 28. A mentor can best support reflective practice among health inspector trainees by A. Encouraging post-inspection journaling and discussions. B. Ignoring reflection time. C. Limiting communication to procedural review. D. Focusing only on test results. 29. When creating online training modules for the HIC exam, engagement can be increased by A. Including interactive quizzes and scenario-based tasks. B. Relying solely on static PDFs. C. Removing learner feedback options. D. Presenting only text-heavy content. 30. Which evaluation approach focuses on long-term learning outcomes rather than immediate recall? A. Summative evaluation with real-world performance measures. B. Daily attendance tracking. C. Pop quizzes on terminology. D. Peer evaluations without standards. 31. When assessing compliance understanding, the most authentic test format is A. Inspection simulations that mirror field conditions. B. True-false recall tests. Oral recitations of law text. D. Open book group quizzes. 32. What is the main role of communication in health inspection reports? A. To clearly convey findings and recommendations to stakeholders. B. To use complex jargon to appear expert. C. To minimize details for brevity. D. To express personal opinions. 33. In professional mentoring within the health inspection field, the mentor's responsibility includes A. Modeling ethical inspection behavior and professional conduct. B. Delegating all responsibility to the mentee. C. Avoiding feedback to test independence. D. Overemphasizing authority and control. 34. When designing a refresher course for certified health inspectors, which teaching strategy best ensures knowledge transfer to on-the-job performance? A. Incorporating field-based case studies followed by group analysis. B. Conducting extended lectures with no practical examples. C. Providing text-based materials only without engagement activities. D. Limiting sessions to written policy reviews. 35. Which evaluation method best determines the effectiveness of mentoring in an HIC training program? A. Monitoring mentee performance improvement over multiple inspections. B. Collecting mentor attendance data only. C. Using self-reported satisfaction surveys without performance metrics. D. Relying on unstructured mentor feedback.